Among these cardiovascular diseases, the most important factor which produces this cardiovascular disease is possibly hypertension or increased blood pressure. The problem with increased blood pressure is that many people do not know. Only half the people who are hypertensive know that they have increased blood pressure. And among these, only half gets treated. And among those half who get treated, only half actually reaches the recommended levels. So it is a pathetic situation as far as blood pressure is concerned. Moreover, blood pressure, as you know, is a silent killer, which means it does not produce any symptoms. The patient who has a high blood pressure will not know he has a high blood pressure unless he checks his blood pressure. So the first message that we have to give you is that you check your blood pressure at least once in a year, whether you are hypertensive or not hypertensive. And the increase in blood pressure or the hypertension is increasing in prevalence in India because number one of the food that we eat, which contains a lot of salt, which contains a lot of sugar, which contains a lot of saturated fat, and the lack of exercise, which results in obesity, which is another factor which produces increased blood pressure. So maybe the best way to tackle this epidemic of non-cardiovascular diseases, this epidemic of cardiovascular diseases is by treating blood pressure, by identifying increased blood pressure and treating high blood pressure. So to discuss on this aspect now, we have a good panel here. I am the moderator. I am Dr. Govindan Unni from Thrissur. We have four eminent panelists with me: Dr. Pancholia from Indore, Dr. Vijay Kumar from Secunderabad, Dr. Chauhan from Bareilly, and Dr. Vipul Gupta from New Delhi. So we'll start the discussion. Let me first ask Dr. Pancholia to tell us what exactly is hypertension, what exactly is blood pressure, because you know usually people say blood pressure is 140/90. So what is this 140? What is this 90? And which is important? Please elaborate on these things. Dr. Pancholia, please.
The lateral pressure which is created by the flowing of the blood in the arteries on its arterial wall is called blood pressure, which is normally there and essential also for the flowing of the blood in the arteries. But when it exceeds the normal, then it is called high blood pressure or hypertension. There are two levels. One is upper level, which is called systolic blood pressure, which is mainly because of the during the contraction of the heart, while the lower level is called diastolic blood pressure, which is during the relaxation of the heart. The normal upper level is around 120 to 130 millimeter of mercury, and lower level normal is 80 millimeter of mercury. More important is the upper level, that is systolic blood pressure, because it is directly correlated with the risk of heart attack and stroke.
Thank you very much, Dr. Pancholia. So when the heart contracts, we get the systolic blood pressure, and when the heart relaxes, we get the diastolic blood pressure. Both are important, but we know that systolic blood pressure is probably little more important than the diastolic blood pressure. Okay, now let us come to the second point, that is heart attack. We are talking about heart disease and hypertension. So let me ask Dr. Chauhan, please tell us what is heart attack. Again, from a point of view of a layman, please explain in simple terms what is heart attack.
Well, the heart is behaving just like a reservoir. It is distributing the blood to the entire body, and just like a cashier who has lot of money but doesn't take its own salary unless until the salary note is made. So similarly, the blood does not the heart does not take the blood directly from the heart which he has. It has three vessels which are called as coronary arteries, are supplying the blood to the heart. Once they get clogged, once they get blocked, then there is a pain in the chest, or maybe there is a sudden death. So this is called as heart attack, and this is a very serious problem which can take in place, which is preventable.
One of the big important problem with heart attack, as you very rightly said, is that the first manifestation of heart attack may be death. So treatment, the patient may not get the treatment. So what you require in this situation is prevention. And one of the major ways how you can prevent heart attack is by controlling the blood pressure. So let me ask Dr. Vijay Kumar, tell me how hypertension or increased blood pressure affects the heart.
Yeah, the relentless blood flow from the left side of the heart, the left ventricle, puts pressure on the arteries, and as the blood pressure increases, it puts much more pressure on the arteries. Normally the arteries are very elastic and pulsatile, so it accommodates a lot of blood flow from the left ventricle. And also the vascular endothelium, that is the inner lining, is very smooth and allows a lot of blood flow to the other organs to receive their oxygen and nutrients. But as the blood pressure increases, the pressure on the arteries increase, and these arteries become more thickened and not amenable to accommodate more blood. At the same time, this pressure can also breach the vascular endothelium. Once the breach occurs, the fats that are circulating in the blood can deposit there and form what is called as an atheroma. This in turn reduces the volume and the circumference of the blood vessel, decreases the blood flow. And not only does it decrease the circumference, it also creates a milieu where a clot can form and can suddenly stop the blood supply to that organ. If it stops the blood supply to the heart, it's called as coronary artery disease. The other problem is the left ventricle has to work harder if the blood pressure goes on increasing. That creates a situation where the left ventricle has to increase its activity, which it does so by increasing its muscle mass. Once the muscle mass is increased, that's called as left ventricular hypertrophy, which is an independent risk factor for coronary artery disease. The other problem is continuous pressure on the arteries. At certain vulnerable points, the arteries give way and create some areas where they are very fragile and form small sacs-like thing called as aneurysms, which can burst and create a life-threatening situation.
So increased blood pressure affects the heart in several ways. It will increase the oxygen need for the heart because the heart has more work to do, but at the same time it will reduce the supply because, as you rightly said, the vessels are damaged and atherosclerotic plaques form. So there are a lot of ways how an uncontrolled blood pressure will affect the heart. There are several factors which produce heart attack, and as you have more and more risk factors, the risk also goes up. One beautiful study which was done on this aspect was the InterHeart study, which looked at the causes of heart attack across the world. Let me request Dr. Vipul Gupta to tell us about this study and what are the risk factors which produce heart attack.
So this is a very important study in the present context what we are discussing. This study was carried out in 1999 to 2003 across 52 countries where around 30,000 patients were taken and around 9 risk factors were studied. The risk factors which were mainly studied were age, sex, race, diabetes, smoking, exercise, intake of fruits and vegetables, hypertension, dyslipidemia and obesity. And it was found in those studies, if we control the risk factors early at the age, then the chances of patients having cardiovascular disease was much less. If the patient has more number of risk factors, the chances of his having cardiovascular disease was much more. And amongst those 9 risk factors, the major risk factors which were found to be more prevalent and effective in controlling were hypertension, diabetes, obesity, as well as the smoking. And if these risk factors were controlled, then the patient will have lesser chances of further cardiovascular events and mortality and morbidity. And we should focus today now controlling in lifestyle modification more than the disease control in a later age, and emphasis should be passing on the message to control these risk factors.
Thank you very much, Dr. Vipul Gupta. So again, let me ask Dr. Pancholia to tell us what is heart failure.
Heart failure is the inability of the heart to pump enough blood to fulfill the requirement of the body. It may be acute when it develops suddenly, particularly when there is sudden acceleration of the blood pressure takes place, or when there is acute heart attack, or when there is sudden rupture of the wall of the heart. So you get acute heart failure. While the chronic heart failure, which is slowly progressing in rheumatic heart disease or valvular heart disease or congenital heart disease, or when there is a disease of the muscle of the heart, what is called cardiomyopathy. It may also be a systolic heart failure and diastolic heart failure. Systolic heart failure develops when the heart is unable to pump with enough force. While the diastolic heart failure, when the inability to fill the proper blood in the heart, so unable to pump out. So the systolic and the diastolic heart failure, and both heart failures are the serious condition and that requires a proper medical care.
So heart failure, as the name itself implies, means the heart is failing to do its function, which is pumping blood to various organs of the body. Now, as you rightly said, there are several causes of heart failure. I think you enumerated quite a large number of causes of heart failure. But like heart attack, it is also a multifactorial disease. And one of the most important factors is again a rise in blood pressure. This was actually shown by another interesting study published called the Splinter trial, the relationship between hypertension and heart failure, and how the incidence of heart failure can be drastically reduced by reducing the blood pressure to very low levels. May I request Dr. Chauhan to enlighten us on this SPRINT trial?
The relationship of hypertension and heart failure is very intense. It has been observed that about patients of heart failure, 80% of them, they are having the hypertension earlier than they get the heart failure. So therefore, the relationship is very complex and very straight. See, what exactly happened, you talked about the SPRINT trial. The SPRINT trial is one of the landmark trial which shows that when you reduce the systolic blood pressure and bring down to 120 or so, in this particular study they have found that if you reduce the systolic blood pressure, say around 120 or so, then you find that the chances of failure becomes very less, especially acute decompensated heart failure is about 36% reduced, which is substantial. Therefore, if you can control the systolic blood pressure adequately, you will be able to take care of this treated complication.
So that is one point that we learned from SPRINT trial, because earlier it was said if you are 70, you can have a blood pressure of 100 plus 70, that 170 is fine. But with SPRINT trial now we know that irrespective of age, whether you are 70 or 80, you have to bring down the blood pressure to
it
as
has been
low
made
as
very
possible.
clear in a senior SPRINT trial.
Correct,
This
correct.
kind of a thing.
Yeah. So your age doesn't matter. Your blood pressure has to come down, and that will prevent not only heart attack but also heart failure. On this note, let's take a short break and we'll be back very soon.
USP, your reliable healthcare partner.
It feels worse when someone handpicks for you every fabric, electronic, every topic. Makes it unique for you, stylistic, chic, and aesthetic. Epic, right?
We curate everything for you before you click. It's never first click. Tata click.
साल होते ही अपना नाम वोटर लिस्ट में रजिस्टर करवाएं और वोट डालने के लिए तैयार हो जाएं। यही आपकी असली ताकत है।
As every point matters in boxing, so does every vote in an election.
तो आइए आज हम ये शपथ लें कि हम अपना वोट जरूर डालें।
Vote for Africa. Vote for Jamaica. पहले, let's vote for India. Domino's World Pizza League. Vote for your champion.
अश्वथ राय 2 मिनट आना।
Thank you, Aisha.
I'm telling you कि ये जानबूझ के उंगली कर रही है, बट अब इन्होंने कुछ किया ना, तो मैं दिखाती हूँ इनको।
You know आयशा, हम कॉलेज में थे जब ये गाना आया था। आशु रिपीट पे सुनता था। तुम तो शायद पैदा भी नहीं हुई होंगी।
इतनी पुरानी है।
35 से एक दिन ज्यादा नहीं लगती है मंजू जी।
लगती है।
USP, your reliable healthcare partner.
So we were discussing about the relationship between high blood pressure and the heart diseases. So we will continue now. The third problem with heart, as far as increased blood pressure is concerned, is that after some time, the heart starts beating irregularly, what is known as atrial fibrillation, and that also has a lot of complications. So let me ask Dr. Vijay Kumar to tell us what is atrial fibrillation and how hypertension affects
As you
that.
rightly said, hypertension is one of the major risk factors for atrial fibrillation. Atrial fibrillation means an irregular fast heart rate. This is created by abnormal electrical impulses that are generated in the atria, and that causes sudden vigorous contractions in the atria. Because atrial fibrillation increases the heart rate, it increases the cardiac workload also. Because the atrial fibrillation also causes the ineffective blood pumping into the ventricles. There's pooling of blood in the left atrium, especially near the left atrial appendage, and it can cause the formation of clots. These clots can get dislodged and get deposited elsewhere, like in the brain most commonly, and can cause a stroke. And moreover, that continuous beating of the atria and conveyance to the ventricle causes the ventricle to weaken, and ultimately they can lead to a situation called as heart failure, that is ineffective pumping from the left ventricle to supply the needs of the body. The other problem, atrial fibrillation per se can also simulate coronary artery syndrome.
So we have discussed three ways how uncontrolled blood pressure affects the heart. One is heart attack, second is heart failure, and the third is the abnormality in the regularity of the heart contraction or atrial fibrillation. Now, you know, medicine is an abstract science, unlike physics or chemistry. In medicine, 2 plus 2 is not always 4. It is somewhere near 4. It can be 3.8 or 4.2 also. So there can be difference of opinion as to what level the blood pressure should come down, in which group of people. Moreover, the situation in US or England, where the most of the money is funded by the insurance companies, is different from India, where we had to pay out of the pockets. And that is why to go over this difference of opinion, we have guidelines from America, from Europe, and even from India. We have Association of Physicians in India guidelines. So let me ask Dr. Vipul Gupta, please tell us what are these guidelines, especially with regard to hypertension. When should you treat a patient? When should you leave a patient alone, etc.?
So as you rightly said, the dictum of 100 plus age is no more longer taken as a blood pressure control levels. There are different guidelines which are prevalent in America and India as well. The commonest guidelines which are given by the AHA ACC take the 120 systolic and 80 millimeter of mercury diastolic as a normal level. But if the levels are between 120 to 129 and 80 to 89, they are taken as elevated levels, and they should be treated in patients who are high risk. High risk means those who have already history of atherosclerotic cardiovascular disease or a renal disease or a stroke. But in patients who are asymptomatic, the levels of above 130/90 should be taken as a basic level and should be treated. The more important is, rather than knowing the levels, is to see and monitor the levels at home. I would suggest that home monitoring of blood pressure is very important in this context, because sometimes we come across white coat hypertension where the patient comes to your clinic, is found to be having a blood pressure very high, 150/100, but he goes home and takes blood pressure. He says, my blood pressure is normal. But then to exclude this, the home monitoring of blood pressure is very important, and to check the blood pressure regularly and follow the doctor and take the medication regularly is more important rather than the guidelines.
Moreover, I think when you take a home blood pressure monitoring, you have to tell the patient that when you get a headache or a giddiness and you check the BP, the blood pressure will be high. That is not hypertension. That is only a reaction to your headache or your giddiness. If you take, actually, many people in that situation take an extra tablet of their antihypertensive medication, which is dangerous because it will drop the blood pressure and in fact may cause a stroke. So home blood pressure monitoring is now being more and more advised, because when you take the blood pressure in the office in presence of a doctor, many times you may have an apparently high level. So from there, from hypertension and heart disease, now let us come to diet, because it is now widely discussed across social media, across lay public, across all sorts of media, the importance of diet in controlling not only hypertension, but also heart disease and diabetes for that matter. Dr. Chauhan, please explain what is that.
See, Actually, this is a very good issue and one of the very, very important thing, because let me make it very clear that the serum cholesterol and diet cholesterol are different. Serum cholesterol is not necessarily to be high, because if it is high, this will get deposited around the arteries and arteries will get blocked. But serum cholesterol is important. But diet cholesterol is not necessarily to be on the very high side.
It's that if you eat more fruits, more vegetables, more legumes, low dairy products, and a bit of poultry, fish and eggs is okay. But you should avoid saturated and unsaturated fats, like sir has already said, especially the red meat, bacon, ghee and other things. This will help in definitely the reduction. The other important aspect of diet is sodium or salt. So salt consumption, most of the bodies that are deal with this have suggested that less than 5 grams of salt is good enough to prevent the onset of hypertension. And in certain situations like heart failure, probably even less than 3 grams of salt is indicated, so that the heart will be able to function better and will also prevent the onset of hypertension. The other aspect which is important is to avoid smoking. Smoking indirectly and directly causes major harm to the arteries and causes and raises hypertension. Alcohol is also a risk factor for hypertension, but if you have to drink, a moderation in alcohol drink is important. 2 ounces of whiskey in a male and 1 ounce in a female is an accepted level of alcohol, but beyond that it causes a problem. And along with these, the control of your stress factors, adequate sleep and other things are also important, and they go a long way in reducing the hypertension.
Thank you, Dr. Vijay Kumar. Last but one question is regarding statins. As you know, the cholesterol lowering drugs. Whom will you give statin? In patient with hypertension, whom will you give statins?
So there is a lot of hype about the statins these days, and there has been 2 groups of patients where we should use statins. First, the primary prevention, where patient already has an atherosclerotic cardiovascular disease like the stroke, peripheral vascular disease, or a cardiac event. Then the levels have to be even brought below 70 milligram percent of LDL cholesterol, which is the bad cholesterol in the common notion. If the patient doesn't have a cardiovascular event earlier, then the secondary prevention is only associated if the patient has associated risk factors like diabetes, and we calculate the risk factor. Now the guidelines are, if the patients are between 40 to 75 years of age with diabetes and hypertension, whatever is the level, they should be put on statins. And the statins dose adjusted is every 4 to 12 weeks, given a higher dose initially and the levels are tested again, and then you can put patient on a lower dose or a maintenance dose, which he can continue and see the risk.
Thank you very much. On this note, I think we will conclude here, giving you the message that heart attack and hypertension or increased blood pressure is a very preventable disease by good lifestyle modification, healthy lifestyle modification, and of course, when you need drugs, you also require that. So I would advise that you shun the 6 S's. There are 6 S which are very important. Salt, sugar and saturated fat. These are the 3 in the diet. And then stress, sedentary lifestyle and smoking. If you shun these 6 S's, most of the problems are solved. Thank you very much.